Our mission at the Family Center is to strengthen all families. One aspect of being a strong family is being a healthy family. Some segments of the population are not getting the services that they need in order to live healthy lifestyles. And our role in that is really just to make sure that the accessibility to those services, programs, and opportunities is there for families that may have other limiting factors.
When a family comes into the Family Center, they could come in because they heard about the center and they're here for the child care or early Head Start opportunities that are here. They may just come in looking for stuff through our advocacy closet, or they're here for adult education or to use the computers that we have available on site. When they come in, they're brought to this place where they start working with a family development worker who starts talking to them about their own goals and what do they want to do. So immediately the family is getting sort of wrapped around in everything that's going on in the center.
We are an early Head Start site, and that means that we're able to serve children year-round, and we're able to uphold the national standards of early Head Start. We went from having 6 slots to now 28 slots. So that just shows the credibility that the Family Center has. The community trusts us to be able to care for their children.
I look forward to coming here every day and seeing all the little kids and spending time with them. These little guys that are 1 year old and they'll be like, Izzy! Like when I come in, it just like melts your heart to hear that they're having a good day and excited to see you.
After Early Head Start, we've instituted the Colorado Preschool Program, but we also offer sliding scale fee assistance and things like that to help folks stay in the workforce so they stay working and they stay moving forward. Folks want that. They want to be able to work and they want to be able to sort of self-actualize.
Family Strengthening Services is a portion of the Family Center. We're not only working with families on where their child is at developmentally, but kind of the whole family well-being in general. Home visitation, family support services, adult education, and health and wellness programs.
Here at the Family Center, like if one of my parents is going through something and they need to be connected with certain community resources, I can refer them to our family development coordinator.
We never say, I'm sorry, we don't have the support here. No, we try to give you the support. And I think the families there feel like this is like a family.
A portion of that program is in the home because that is where families interact the most. So you can be doing these different activities and having these different conversations. I don't think we would be able to do this kind of work without all of our community members, grandparents through the foster grandparents program, CSU students and students at other schools. You start building a community amongst those who are participating.
We have our food access programs, which include a community garden, free farmers markets, and free garden workshops. Application assistance for Medicaid and CHP Plus, as well as presumptive eligibility in both English and Spanish. Clients can come here and fill out an application if they're pregnant or have a child and receive a card the same day that allows them to go get medical services before their Medicaid application has actually been officially approved. To be able to come in and walk out with that ability to go straight to the doctor.
This is Adam from Poder Fire, who's training with me, and I'm Laura. I work at the hospital. We come here once a month, and we're full almost every single time. We take a total of 12 families. And we were giving out between 400 and 500 seats per year. Regardless of our funding, we say we will always keep the Family Center class going, even if we have to beg $4 to buy car seats.
So the number of children in Colorado living at the poverty level, at or below the poverty level, has grown faster, much faster than the national average. As funding gets removed, then programs go away. But the problem is that if programs go away, the children don't. They're still here. The families don't. They're still here.
I mean, obviously, sustainable funding is the key. And my idea of that would be more localized funding. People who are in the community, who know about the Family Center, who understand and really seeing the impact that it has on everyone.
The Family Center has worked really hard on our reputation with our families in the community. There's a safe, stable environment, optimal learning environments for their children to be at. Our community partners see that and they want to be a part of what we bring to the community. We'd like to take it a step further and have investment from community members to be a part of what we do.
One unique thing about the Family Center is that our staff tends to be really representative of the population we serve. There's not that sense of like segregation or separation, this is them and us. It's kind of that we're in it together and we're all part of Fort Collins.
We have a really great team, and they're the ones that are there every day, opening the doors, providing the care. They've been able to give so many years and so much dedication to the agency and to the families they serve that we want to be able to have that be reflected in the way that we compensate them.
So I think that it's important too that people who are supporting the center know what's going on. And the way to do that is to come into the center. Find the program that you connect with, take a tour, see what the Family Center does firsthand. What we need is a large individual donor base, a large group of people that are willing to donate something that is going to continue to help families locally strive, move forward, and become more self-sufficient.
Families are the foundation for a community, and a community is the foundation for society. So if you want to have a strong society, I think you have to start with strong families.